Welcome to Gamble with Brandl. Today we have a 24-year-old coming to the physician because of poor sleep for the past 6 months. Her mother passed away recently and she has trouble falling asleep. You recommend a short-term pharmacologic treatment that doesn't make her dizzy in the morning when she drives her daughter to kindergarten. And we're given here a couple of options. So what would you recommend? So we are dealing here with insomnia. And when we are thinking about insomnia, well, generally we always want to figure out if you're dealing with sleep onset insomnia or sleep maintenance insomnia. So do you have trouble falling asleep, that's sleep onset insomnia, or do you have trouble maintaining the sleep? Obviously, some patients have both, so it's not exclusive. So generally, this looks like sleep onset insomnia, and for this purpose, we would rather use any drugs if you want to have pharmacologic treatment that have a pretty short half-life, get out of the system so that you're not going to feel dizzy in the morning and can do your daily activities. There's one drug that comes to mind that's called Ramelteon, which is only approved for sleep onset insomnia. It's a melatonin agonist. That's where the Melteon comes from. That would be one option. And the other option, so that's not on this list, the other option would be going to some sort of a benzo or a benzo analog, which is, or a novel benzo for short-term treatment. However, novel benzos are definitively the one that are highly preferred over the benzos because in the end, they have just less adverse effects and less problems with dependence, so you would always rather go for those. And these are sometimes called novel benzos or the Z drugs because they have all a Z in their name. Things like zolpidem, saleplon, or esopiclon. So these are the Z drugs. So that would be another option. So if you're looking here, let's think about these different drugs. Diazepam is a benzo, so definitively not something preferred. So we would rather look for this or that one. And also has a very long half-life. And that's a disadvantage because obviously we want to not have a drug that makes you dizzy in the morning. Phenobarbital, I hope nobody would pick that. I mean, this was kind of a drug for insomnia a long time ago. It's basically obsolete. Before we had benzos, if you see phenobarbital now around, it's mainly used as a seizure medications in very little kids. Diphenhydramine is a H1 antagonist. Makes you very sleepy in the morning. Zolpidem is such a C drug. That's a novel benzo drug, BDZ for benzodiazepine. And flumazenil is a benzo antagonist. So that's something you give in an overdose with a benzo. So this gets us to zolpidem here as the correct answer. And these drugs are C drugs, things like zolpidem, saleplon, or esopiclon. Well, they're more or less safe and they have less adverse effects than the benzos. They have also shorter half-life, so they're usually out of the system, and we have a lot of different formulations. So for zolpidem, they have also a sublingual tablet, so even if you would wake up in the middle of the night, you can put it under your tongue, and it's still pretty quickly out of your system. So it's not a bad idea to have, particularly for the benzos, some sort of idea where the different half-lives fall, because if you're thinking about sleep onset versus sleep maintenance insomnia, we want to have an idea what to recommend to a patient. So there's one nice mnemonic, this is from my colleague Steve Schneid, who has also a channel, Schneid Guide, and this goes, try my oats, funky doctor. And so the tri-mi stands for triazolam, midazolam, tri-mi, and these are very short acting, so they have a short half-life. Then the oats are the intermediate half-life, T half. I'm going to write them here. So oat stands for oxazepam, A stands for alprazolam, and T for temazepam. So these are the oats, so intermediate. And then the funky doctor stands for flurazepam and diazepam. And they have a very long half-life. So they would be very long in your system. So definitively it's going to give you, makes you very drowsy next morning as well.